Today, we are going to go over our wellness conversations. Joining me today is Dr. Luyeho with the Henry Ford Health System. We're going to have a conversation on hypertension and who's at risk, how to manage it, and Dr. Luyeho is going to take it from here for us. Thank you for joining us today.
Hi, I'm very excited to be here with all of you, and specifically for that we're going to be talking about hypertension. This particular disease is something that we live with. It is not, it doesn't spare anyone in any community. We might actually have hypertension without actually knowing it. So right from the get-go, what is hypertension? Hypertension is elevated blood pressure. All of us have a blood pressure. If you don't have a blood pressure, you won't be living. So hypertension is an elevated blood pressure. There are certain diagnostic criteria for hypertension. Typically, any blood pressure that's above 140, that's the top number, systolic, but in layman's term, we call it the top number should be more than 140 to be diagnosed with hypertension, or the bottom number to be 90 or above to be diagnosed with hypertension. And again, you don't just have hypertension. Well, I went to the doctor's visit or I stopped by a pharmacy, they got my blood pressure. I checked it and it's high, now I have hypertension. It has to be sustained for over, another check, for example, in a week's time or in 2 weeks' time. Now, who exactly what's the cause? Right now, it's not clear why some of us have hypertension. Is it genetics? Is it some of the environmental factors? No one really knows. And this is what we call primary hypertension. I'm just going to put it in layman's terms. The hypertension that most 95% of us have. No one knows exactly. Some of the risk factors include age. The more advanced years we have, the higher the risk factor. Obesity, any family history of hypertension. Race comes into play if we eat a diet high in sodium, or we have physical inactivity. Those are some of the risk factors for developing hypertension. Why do we care so much about hypertension? What's the big deal about hypertension? Well, it's important because hypertension typically occurs. I might have it, you might have it, no one can tell unless you go and get checked out. That's why it's so important to go to your doctor, have a 1-year visit, an annual visit to your primary care doctor. Even if you're feeling great, just go in for that check. And part of the checkup is you get a blood pressure checked. You might be feeling great and you're walking around with a blood pressure of 210 over 140, but you feel great. And the only time you'll get to know is when something bad happens. So therefore, that's why we're very concerned about hypertension and catching it early through annual regular visits to your primary care doctor. Now, what are some of the bad things we don't want to get to? One of them is heart failure. Think about the heart as a pump. The pump is working against a lot of pressure. After a while, the pump starts getting tired and failing. Then you get a weak heart because after years of pumping against high blood pressure, the heart fails. We don't want to get to that point. If you control the blood pressure, if it's caught early, you avoid the heart failure. A stroke, walking around with a blood pressure of 240 without knowing, and you feel great. The end effect of uncontrolled high blood pressure is a stroke, and we don't want to get to that, to that point. A very common thing among all of the communities in the US and in the whole world is chronic kidney disease. As the kidneys see pressure, extreme pressure for years and years on end, eventually the kidneys also start failing because they cannot handle all that pressure. So a patient develops chronic kidney disease. We don't want to get to that point. We want to control the blood pressure before it gets to that point. So these are some of the complications and the reasons why we should pay very close attention to diagnosing and treating high blood pressure as soon as we can.
Thank you. I learned I learned something new. I did not know that hypertension affected the kidneys in any way at all. So this is why these conversations are so helpful, because the knowledge is not just having one thing, is knowing what else it could potentially affect. What would you say? So if someone was going to their doctor, they had questions about their blood pressure, could you help them maybe, or help me understand some of the questions that should be asked to a person's primary care physician?
Sure. Very excellent question. Some of the questions you should be asking your primary care doctor: what was my blood pressure? Was it normal? Was it low? Was it high? Was it where? What was my blood pressure? That's a very important question. Sometimes, you go to the doctor's office, they take your blood pressure and off you go. Well, was my blood pressure normal? Was it low? So that's an important question. What was my blood pressure? In addition, taking a look at, is there any medication I'm taking that could potentially increase my blood pressure? I'm taking something for my arthritis. Long term, would that have any effect on my blood pressure? So asking your doctor, is there anything that I'm taking prescribed that could actually cause my blood pressure to be elevated?
Thank you. And that's another thing that people may not be aware of about the cross medications that may cause that very thing. Lifestyle habits. Is there anything that one can do to, and you spoke to this, but to intentionally do in terms of lifestyle, be it physical exercise or nutrition, to control their blood pressure?
Yes, absolutely. And even if your pressure is normal, there are things that you should avoid or avoid. One of them, high salt diet. In no way am I saying quit salt. We all need a little bit of salt. So stay away from a high salt diet. The main culprit, chips, soups, canned soups have a ton of salt in them. And also, guess what? Pop, regular pop, if you look at it, it has sodium, salt in it. So staying away or limiting the amount of salt, foods that contain salt, I would say, limit the amount of foods that contain salt. And most of all, just staying active. And then when you go to the gym, instead of, take a walk. It's warm in the weather, depending on the weather, take a walk, take a walk. Just get active a couple of times in a week, staying active, and see what watch what you eat.
Thank you. And then one of the last questions to wrap it up with, we all have blood pressure at every age, but for persons living with high blood pressure, how often should they be taking their blood pressure when self-monitoring?
I would recommend taking it maybe every day, ideally. And if you're not able to every day, 3 times a week, and keeping a log of the blood pressure that you take, so that when you see your doctor, you can actually present your physician with your blood pressure logs.
Thank you. And with the physical activity and the blood pressure, I am actively encouraging members of the community to get in 150 minutes of physical activity. If there's a person who maybe lives a sedentary lifestyle, let's say balancing the nutrition piece and the physical activity and the lifestyle, but is there any way for those persons who don't have the mobility to also become more active? Would there be like upper body exercises that can help, maybe just simple movement that can help, with me encouraging persons to get physically active to lower their blood pressure? What I'm finding is that a lot of people are saying that I don't have, I can't move around a lot. I can't do a lot of this, a lot of that. Is there anything that you could say to them that they could potentially change to sort of help them get going with that? I guess let me rephrase that question to say, if you don't have a lot of mobility, what is something that a person can do to help curb not being able to get in so much physical activity, but to still manage their blood pressure?
Sure. So some of us who are limited by physical ailments and you cannot physically be active, Therefore, some of the most important things you can limit is the amount of sodium you take, so your diet, the amount of sodium you take, the medications that you take. And I'll give an example, nasal decongestants, some of them like Sudafed can raise your blood pressure significantly. So watching what you take, even over-the-counter medications. And I think most important is the amount of sodium you take in your diet per day.
Thank you. I appreciate that. And that does bring some awareness. I know that there's medications. They also, they give a label about it being for persons living with high blood pressure. Also, I've seen that on some medications. So that's really helpful information. Is there anything that you'd like to add to this conversation that I have not covered? Or asked, I should say?
No, I think we've covered it all in this short span of time. This has been great.
Yes, it has. Well, I thank you so very much for taking the time out of your day to speak with me. This conversation is going to help a lot of people. I know that to be true. I've been asked many questions about how to help manage and what to ask my doctor. And of course, I'm limited in the information which I can share about what one should say to their doctor. So you've helped me out tremendously with this conversation. And Dr. Luyeho, I know that you're busy and you have your meetings, but if ever in the future you'd like to come back and add to this conversation so that community members can receive more of your knowledge and wisdom, please come back. Let me know that you'd like to be here again, and I'll quickly make it happen.
Thank you. Thank you. Thank you so much for having me.